Cancer is hitting younger Americans like never before. Gastrointestinal cancers are skyrocketing in people under 50, and doctors are sounding the alarm. With colorectal cancer cases doubling in young adults, this could affect you or someone you love. Watch now to learn why this is happening and how to protect yourself. Hey America! Gastrointestinal cancers, those affecting the colon, stomach, pancreas, and more, are no longer just an older person's disease. A 2025 JAMA review reports a 14.8% rise in these cancers among U.S. adults under 50 between 2010 and 2019, making them the fastest-growing cancers in this age group. In 2022, nearly 21,000 young Americans were diagnosed with colorectal cancer alone, per the American Cancer Society. In this video, we're diving into why gastrointestinal cancers are surging in people as young as 20, what's driving this alarming trend, and how you can lower your risk. Backed by cutting-edge research, we'll explore modifiable risk factors, early detection, and practical steps for U.S. families. With $150 billion in annual cancer-related healthcare costs, per the CDC, this is a wake-up call. Let's act now to protect our future. Gastrointestinal cancers, including colorectal, stomach, pancreatic, esophageal, and rarer types like biliary and neuroendocrine tumors, are surging in Americans under 50. A 2025 JAMA review, summarizing 115 studies from 2014 to 2025, found colorectal cancer as the most common, with 20,800 U.S. cases in 2022. Pancreatic cancer, 2,657 cases. Gastric cancer, 2,689 cases. And esophageal cancer, 875 cases, are also rising, per the same review. Since 2011, colorectal cancer diagnoses in this age group have increased 2% annually, per the American Cancer Society. The rise is stark in younger groups, a 333% increase in colorectal cancer among teens aged 15 to 19, and a 185% increase in those 20 to 24. Per a 2025 CDC analysis. Dr. John Marshall from the Colorectal Cancer Alliance notes, "It never used to happen in this age group, and now we're seeing 20, 30, and 40-year-olds diagnosed. High-profile cases, like actor Chadwick Boseman, who died of colon cancer at 43 in 2020, highlight this shift. Key statistics. Colorectal cancer is the leading cause of cancer deaths in men under 50 and second in women, per a 2025 British Journal of Surgery study. Early-onset cases are often diagnosed at advanced stages, reducing survival rates, per a 2025 JAMA study. Black, Hispanic, and Indigenous groups face higher rates, with 16.5% of American Indian, Alaska Native patients diagnosed before 50, versus 6.7% of non-Hispanic whites, per a National Cancer Institute analysis. This trend isn't just a U.S. problem, it's global, especially in high-income countries, per a 2025 British Journal of Surgery study. But why is this happening? Let's explore the causes. Doctors aren't fully sure why GI cancers are rising in young adults, but research points to a mix of modifiable and non-modifiable risk factors. Let's break them down. Modifiable risk factors. Obesity. A 2019 study of 85,000 women found that a BMI over 30 nearly doubles the risk of early-onset colorectal cancer, per a 2025 British Journal of Surgery study. In the U.S., 40% of adults are obese, per a 2024 CDC report. Poor diet. Diets high in processed meats, sugar-sweetened beverages, and ultra-processed foods increase risk, per a 2025 JAMA review. Americans consume 60% of calories from ultra-processed foods, per a 2024 USDA report. Sedentary lifestyle, lack of exercise contributes, with only 25% of U.S. adults meeting activity guidelines, per the CDC. Smoking and alcohol. Smoking increases gastric cancer risk by 1.74 times, per a 2023 meta-analysis, while excessive alcohol raises risk for liver and esophageal cancers, per a 2020 nutrient study. Gut microbiome. Changes in gut bacteria, influenced by diet, antibiotics, and microplastics, may promote inflammation and cancer, per a 2021 Journal of Translational Medicine study. Non-modifiable risk factors. Genetics: 15 to 30% of early-onset GI cancer patients have hereditary mutations, like Lynch syndrome, per a 2025 JAMA review. Genetic testing is recommended for those diagnosed under 50. Family history: a family history of GI cancers or polyps increases risk, per a 2023 gastroenterology study. Ethnic disparities: Black, Hispanic, and Indigenous groups face higher rates, per a 2025 National Cancer Institute analysis. Dr. Scott Kopetz from MD Anderson notes, if we understand colorectal cancer causes, it could guide us on other GI cancers. These factors are within our control, and small changes can make a big difference. You can lower your risk of GI cancers with practical, science-backed strategies. Here's how. Adopt a healthy diet. Focus on fiber-rich foods like fruits, vegetables, and whole grains. A 2023 Journal of Nutrition study found that 25 grams of fiber daily reduces colorectal cancer risk by 10%. Limit processed meats and sugary drinks. Swap burgers for grilled chicken or plant-based options, available at U.S. stores like Whole Foods, $5.10/pound. Try the Mediterranean diet, which cuts cancer risk by 12%, per a 2024 nutrient study. Stay active. Aim for 150 minutes of moderate exercise weekly, like brisk walking or cycling. A 2023 gastroenterology study showed this lowers colorectal cancer risk by 15%. Join local U.S. fitness programs, like YMCA classes, $20.50/month, or use free park trails. Maintain a healthy weight. Losing 5 to 10% of body weight reduces cancer risk, per a 2023 obesity study. Apps like MyFitnessPal, $50 per year, help track calories. Limit alcohol and quit smoking. Keep alcohol to 1 drink daily for women, 2 for men, per CDC guidelines. Use smoking cessation programs like those from the American Lung Association free online. Support your gut microbiome. Eat probiotic-rich foods like yogurt or fermented vegetables, available at Target $4.35. A 2021 gut study linked probiotics to lower inflammation. Practical tip: start with small changes, like adding a daily salad or a 15-minute walk. A 2025 British Journal of Surgery study estimates that 50% of GI cancers could be prevented with lifestyle changes. Early detection saves lives, but young adults often miss it because symptoms like abdominal pain or blood in stool are dismissed. A 2025 JAMA review notes that early-onset GI cancers are often diagnosed at advanced stages, worsening survival rates. Dr. Howard Hochster from Rutgers Cancer Institute says, "We don't think of cancer in young people, so diagnoses are delayed." Screening guidelines. The American Cancer Society lowered colorectal cancer screening to age 45 from 50 due to rising cases, per a 2025 JAMA review. Those with family history or genetic risks like Lynch syndrome should screen at 40 or earlier, per a 2023 gastroenterology study. Tests include colonoscopies, $1,000,3,000, often covered by insurance, or at-home stool tests, $100,500, per a 2024 Healthline report. Symptoms to watch: blood in stool, persistent abdominal pain, unexplained weight loss, or changes in bowel habits. If you notice these, see a doctor immediately. A 2024 Medical News Today study suggests earlier screening, age 40, for high-risk groups like Black and Hispanic Americans. Genetic testing. 15 to 30% of early-onset cases involve hereditary mutations, per a 2025 JAMA review. Testing costs $200-$500 at U.S. clinics like Mayo Clinic. Practical tip: schedule a colonoscopy at 45 or earlier if high risk. Check insurance coverage through healthcare.gov, and use free clinics for low-income Americans. Young adults with GI cancers face unique challenges. A 2025 British Journal of Surgery study notes that 50% of patients report unmet needs, like fertility concerns, anxiety, and financial strain. Survivors often face body image issues, sexual dysfunction, and depression, per a 2023 Cancer Discovery study. Support options. Fertility counseling. The American Society of Clinical Oncology recommends discussing fertility before treatment, yet 50% of patients miss this, per a 2025 study. Mental health. Access counseling through Dana-Farber's Young Onset Colorectal Cancer Center or online platforms like BetterHelp, $60 per week. Financial aid. Programs like the Cancer Care Copayment Assistance Foundation help with costs. Community. Join support groups via the Colorectal Cancer Alliance, free online. Practical tip. Connect with resources at dana-farber.org or cancer.org for tailored support. A 2023 study showed support groups improve quality of life by 20%. GI cancers are rising in young Americans, but you can fight back. Take our 30-day cancer prevention challenge. Eat more fiber, exercise daily, limit alcohol, and schedule a screening if you're 45 or high risk. Share your journey at cancer.org and inspire others. With 21,000 young adults diagnosed yearly, your actions matter. Talk to your doctor about symptoms or genetic testing, and let's reduce GI cancer rates across America. Subscribe to our channel for more daily health tips to keep you thriving. That's the truth about the rise of GI cancers in people under 50. Subscribe for more daily health tips and comment below. What's one step you're taking to lower your risk? Let's keep the conversation going and build a healthier America. See you tomorrow.